Yalimadad. My name is Dr. Samir Hirji, and I'm a surgeon at Harvard University in Boston, Massachusetts. Today, I wanted to share some important information on the latest research and also understanding what we need to do as a Jamaat to live in these challenging times of COVID-19. First of all, there is very limited data on vaccinations at this time. However, vaccinations aina. There are so many people working on so many studies and research all across the world. But at this time, there is no vaccination. And we don't expect a vaccination to be there within 3, 6, or even 9 months. However, current research suggests kareta कि vaccination achna may be in 1 year or up to 18 months. So for the Jamaat, we need to be very careful and extremely careful range in order to do things that are important for us to be safe in these times of COVID-19. Also, for people who are suspected of COVID-19, or if you have symptoms of COVID-19, it is important that we isolate ourselves. Current research shows that the virus lives around 9 to 10 days in some people, and it's still active and transmittable up to 14 days. એટલે કે up to 2 weeks, 2 week વાસ્તે, if you feel that you have symptoms, it is my utmost hope that you stay away from people. Try to isolate yourselves from other people so that you can avoid infecting them. I know it is challenging. People have to go to work, people have commitments, and as these times ask us to adapt in very challenging ways, it is important for us to be very careful. Second, there are many drugs out there that have been proposed. One is remdesivir. At this time, it's only used in clinical trials or only in studies of certain patients. What it means is that jo anke bimari the, anke jo COVID-19 way, the drug is not just available to help you in your recovery. It's only used in certain cases, and data doesn't show much efficacy at this time. Second, there is new data that shows that steroids may help, and we have seen patients in whom steroids are helpful. But keep in mind that these drugs, khali drug, unche vaste jai, that they are hospitalized, and so these drugs help them in very limited ways. So the bottom line is, right now, there isn't much data out there. And it's extremely important for us to be careful and try to prevent as much as we can to get the virus. Now, there are important things that we need to be careful for. First, we need to wash our hands often. Panke hath jon jo jai. Panke also try karan jai ke pa avoid karje contact with people who are sick, people who are older, so that they don't get affected. If you are young, we may not be as susceptible to the virus, but it's very important that we should be careful so that we don't spread this virus to other people. Third, always cover your mouth. Even though if you don't have symptoms, it is very important that we use some sort of covers, face cover, mouth cover, whenever we are around. Ne bijo limit karno khape how much we spend time with other people outside. We never know who is infected, who's not. It is very important for us to exercise caution as we continue to live our normal lives. Fourth, it is also very important that we protect ourselves. So if you're coughing, cover yourself. If you're sneezing, cover yourself. And at the same time, disinfect and clean every surrounding that you touch. So be it at work, as some people are going back to work, or be it at home. Every surface that you touch, it is important to wipe it down as frequently as possible, because in some surfaces the virus can live longer, and these are the studies that they have been showing. As we move across, as inshallah, the Jamaat resumes its normal activities. In addition to the things I've mentioned, it is also very important that we educate our employees to stay home when they are sick. We will come into contact with a lot of people when we resume work, and we don't know who's sick and who's not. So it is extremely important that we continue to be safe, educate employees, and if they feel that they have symptoms, tell them to stay home. It is much better for their safety and for your safety. And again, like I said, covering faces is important. However, face covering should not be placed on babies and children younger than 2 years old, anyone who has trouble breathing, and anyone who has incapacitated or needs assistance in doing that. These are some of the things that are essential for us to live in these challenging times of COVID-19. The Jamaat has done a great job so far. They're trying their best. There's a lot of people adapting to the challenging times. These are challenging times, not just in Tanzania, but also globally. But we as a Jamaat, we can work together, help each other, support each other.